Assalamualaikum and very good morning to everyone. My name is Zulaikha Zulkarnain. So today in this video, I would like to talk about statins. I will not take too much time, so let's jump to the next video. So basically, statin medications are used to lower the level of cholesterol in the blood and protect the inside of the artery walls. High level of cholesterol can lead to fatty deposits building in the open arteries, increasing the risk of heart and circulatory diseases, which can cause angina, heart attack, or stroke. The most common statin medications are simvastatin, atorvastatin, and rosuvastatin. The main way you can remember this statin medication is by the ending, which is statin. You may be wondering why you need to take these statin medications, or what they are for, or how do they work. Your doctor is going to consider your cholesterol levels and assess your risk factor for heart and circulatory diseases to determine if you need them. You may be advised to take statins if you have had a heart attack or stroke already to reduce the risk of a second episode, or if you are a diabetic, a family history of heart disease, or genetically high class of cholesterol in your family, which known as familial hypercholesterolemia. It is also one of the reasons why you may prescribe statins. Some others over the ages of 65 are advised to take statin as precaution to help reduce the risk of stroke. We touch a little bit of cholesterol. So, cholesterol is created by the liver and it is transported around the body by two main lipoproteins. The first is called LDL, which stands for low density lipoprotein. This is also known as bad cholesterol. Bad cholesterol is responsible for transporting cholesterol around the body, often depositing this cholesterol in your arteries and increasing your risk of atherosclerosis, which causes your blood vessels to narrow. The second is called HDL, or high-density lipoprotein, which is considered as good cholesterol. This type of molecule transports or stores cholesterol around the body and transports it to be delivered and to be broken down. The way statin medications work is that they competitively inhibit the enzyme HMG coenzyme A reductase. And what this enzyme does is, it will catalyze the reduction of HMG coenzyme A into methylenic acid, which eventually goes on to be converted to the cholesterol. So, because of this, there is a reduction in the amount of cholesterol being produced by the liver. To compensate for this, we have an upregulation of LDL receptors in the liver, so more LDL is taken into the liver and cleared from the bloodstream. The overall effect is a reduced amount of cholesterol being produced by the liver and reduces the LDL level in the blood. And the less cholesterol we have, the less LDL we have. So long short story, all statins are HMG-CoA reductase inhibitors because they block the conversion of HMG-CoA into cholesterol in the liver. To be noted, lovastatin is a prodrug and inactive lactone in its native form. The gamma-lactone closed ring forming, which it is administered, is hydrolyzed in vivo to the beta-hydroxy acid open ring form, which is the active form. Additionally, there are other ways to help reduce your cholesterol levels. This involves adopting a healthy lifestyle, including exercise and maintaining a healthy BMI. Stopping smoking and reducing alcohol intake can also help lower your cholesterol levels. So, these are the 8 analogs of lovastatin, which is we have lovastatin, simvastatin, pravastatin, pitavastatin, serivastatin, atorvastatin, rosuvastatin, and also fluvastatin. So, we are at the ending of the video. This is the most important thing in the medicinal chemistry, which is structure-activity relationship. Here at my back, we have structure-activity relationship of lovastatin. So, for the first, the 3,5-dehydroxycarboxylate is essential for inhibitory activity, which is compound containing lactone or prodrugs requiring in vivo hydrolysis. Second, all statin possess a common structure L-hexahydronaphthalene system and B-hydroxylactone, their differences are due to side chains, which is R1, and methyl groups, which is R2, around the ring. Third, the lactone ring is essential for activity and makes a prodrug, which is hydrolyzed to give active 3,5-dihydroxyheptanoic acid. Fourth, the conversion of ester to ether decreases the activity. Fifth, N-ethylene bridge are essential for the activity. So, in conclusion, statins are widely prescribed class of medications used to lower cholesterol levels and reduce the risk of cardiovascular events. Their effectiveness in managing cholesterol and their overall cardiovascular benefits make them a cornerstone in the preventing and treatment of heart disease. Statins are also a class of medication with a well-established pharmacology. They work primarily by inhibiting cholesterol synthesis, have beneficial effect on cholesterol levels and cardiovascular risk, and are generally safe and effective when used under medicinal supervision. However, their use should be carefully monitored by a healthcare provider to ensure their safety and efficacy. Additionally, lifestyle modifications such as dietary changes, exercise, and smoking cessation are often recommended alongside statin therapy to maximize cardiovascular risk reduction.
A few moments later.
So these are the end of the video. Thank you for your listening. I hope you get something from my explanation. And if you want to ask something about my explanation, please comment below. See you soon. Bye. Your risk of atherosclerosis. You may be wondering why you need to